Hello and welcome to our channel. Let's start this video with a question. Do you know what schizophrenia is? Well, schizophrenia is a serious mental health condition that affects millions of people worldwide. Today, we'll be delving into the topic of schizophrenia, a condition that's often misunderstood and stigmatized. This condition is not as uncommon as you might think. In fact, schizophrenia affects roughly 1% of the global population. That's about 75 million people. It's a condition that alters a person's perception of reality, impacting how they think, feel, and behave. Because of these effects, it's crucial that we strive to understand and empathize with those living with schizophrenia. By doing so, we can contribute to a more supportive and caring society. Understanding schizophrenia isn't just about statistics and medical jargon. It's about recognizing the human experience behind the condition and acknowledging the courage it takes to navigate life with schizophrenia. So buckle up as we embark on a journey to understand schizophrenia better. Now, you may wonder, how does schizophrenia manifest itself? What are the signs and symptoms we should look out for? Let's delve into it. Schizophrenia is a complex condition that affects the way a person thinks, feels, and behaves. It's like a tangled web with various strands representing different symptoms. One of the most common is hallucinations. Imagine hearing voices whispering in your ear, seeing things that aren't there, or feeling sensations on your skin when nothing is touching you. These are vivid and often unsettling experiences that can feel entirely real to the person experiencing them. Equally puzzling are delusions. These are firmly held beliefs that persist despite clear evidence to the contrary. For instance, a person might believe they're being followed or monitored by unseen entities, or that they possess extraordinary powers or status. These beliefs can seem bizarre to others, but are incredibly real for the person with schizophrenia. Next, we have cognitive symptoms. These can involve trouble focusing, difficulty following a conversation, or problems with memory. These might manifest as a person drifting off in the middle of a task or struggling to keep up with a fast-paced discussion. Then we have emotional symptoms. People with schizophrenia might show little emotion or respond inappropriately to situations. They might laugh at a sad story or show no reaction to exciting news. This isn't because they don't care, but rather because their emotional responses are out of sync with the world around them. Another common sign is social withdrawal. The person might pull away from friends and family or stop participating in activities they once enjoyed. This isn't because they've suddenly become antisocial, but rather because they're grappling with a world that feels overwhelming and confusing. Lastly, there's difficulty with daily tasks. Simple activities like personal hygiene, cooking, or maintaining a home can become challenging. This can often be due to a combination of other symptoms, like cognitive issues or social withdrawal. Remember, these symptoms can differ greatly from person to person, and not everyone will experience all these signs. While schizophrenia can be a challenging condition, there are effective treatments available that can help manage the symptoms. Let's start with medication. Antipsychotic drugs are often the first line of treatment for schizophrenia. These medicines can help reduce the intensity of hallucinations and delusions, making them less distressing. They can also help with other symptoms like disorganized thinking and negative symptoms, which include lack of motivation and reduced emotional expression. It's worth noting, though, that finding the right medication and dosage can be a process of trial and error. Everyone is different, and what works for one person might not work for another. But with patience and regular communication with a healthcare provider, it's possible to find a medication regimen that helps. But medication is just one part of the treatment puzzle. Therapy plays a crucial role too. One popular form of therapy for schizophrenia is cognitive behavioral therapy, or CBT for short. CBT helps individuals learn to challenge and change unhelpful thought patterns and behaviors. It can help people with schizophrenia understand and manage their symptoms, cope with stress, and lead more satisfying lives. Another important type of therapy is family therapy. Schizophrenia doesn't just affect the individual diagnosed with the condition, it impacts their entire family. Family therapy can help everyone involved learn to communicate more effectively, solve problems together, and create a supportive home environment. It's a vital part of creating a holistic treatment plan. In addition to medication and therapy, lifestyle changes can also play a role in managing schizophrenia. Regular exercise, a healthy diet, adequate sleep, and avoiding drugs and alcohol can all contribute to better overall health and well-being. So you see, while schizophrenia is a complex condition, it's not an insurmountable one. With a combination of medication, therapy, and lifestyle changes, it's entirely possible to manage the symptoms of schizophrenia and lead a fulfilling life. With the right treatment plan, individuals with schizophrenia can lead fulfilling and productive lives. To sum up, schizophrenia is a complex condition that affects thought processes, emotions, and behaviors. It's a mental health disorder characterized by hallucinations, delusions, and struggles with everyday tasks. Each person's experience with schizophrenia is unique, with symptoms varying widely from person to person. Treatment for this condition typically includes a blend of medication and therapy. Antipsychotic medicines can help manage symptoms, while cognitive behavioral therapy and family therapy can offer strategies for coping and foster a supportive home environment. While it's a serious condition, it's crucial to remember that there is always hope. There are numerous resources and treatment options available to help manage schizophrenia and improve quality of life. Remember, if you or someone you know is dealing with schizophrenia, it's crucial to seek help. There is always hope and help available. Thank you for watching, and don't forget to like, subscribe, and hit the bell icon for notifications of when more informative content like this is added. Take care.